Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Croup. Introduction. Croup is a disease that causes problems with breathing. It is most often caused by a virus. Croup is common in young children. It causes a cough that may sound like a dog or seal's bark. Croup usually goes away on its own. It is most common in children who are between 6 months and 3 years old. Croup is a common cause of stridor, a condition that causes a wheezing sound in the upper airway. This program explains croup. It covers the anatomy of the respiratory system, as well as the symptoms and causes of croup. It also explains how croup is diagnosed and treated. The respiratory system. Oxygen is necessary for life. Without it, a person can't live. When we breathe in, the air goes through the mouth and nose. From there, it goes to the air pipe or the trachea. From the trachea, it goes into smaller tubes called bronchial tubes. The air we breathe comes in close contact with the blood in our lungs. The blood fills up with oxygen and releases carbon dioxide, or CO2. Croup. Croup happens when the upper airway becomes infected. This causes the larynx, trachea, and bronchial tubes to become inflamed. This inflammation can make it hard to breathe normally. The vocal cords are found in the larynx. Croup causes them to become inflamed. Coughing through inflamed vocal cords makes a sound like a seal or dog's bark. The inflamed airway can also cause a wheezing sound called stridor. Croup is most often found in children under 3. It is common in the winter. Croup is contagious. This means that it can be spread from child to child.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. Croup often starts as a mild cold. The symptoms of croup include a runny nose and slight cough. Early signs of croup also include a frequent cough and low fever. After about 2 days, croup will cause a loud, frequent, and hoarse cough. Many people compare the cough to a barking seal. Other symptoms of croup include difficulty swallowing, hoarseness or a scratchy throat and voice, mild breathing trouble, stridor or wheezing. Symptoms of croup are often worse at night. They can cause trouble sleeping. Younger children often show more symptoms than older children and adults. Symptoms of croup are often mild and do not require immediate care. Rarely, croup can become serious and require hospitalization. More serious signs of croup include abnormal anxiety or irritability, blue or gray skin around the nose and mouth, constant stridor or wheezing, fast and shallow breathing, high fever. Causes. Croup is most often caused by a virus like influenza or the flu. Other viruses that can cause croup include adenovirus, parainfluenza, measles, respiratory syncytial virus or RSV, rhinovirus. Viruses that cause croup are easily passed from child to child. They are most common in the fall and winter. Viruses can be spread without direct contact from child to child. They can be passed on through coughing or sneezing on toys, books, and other surfaces with which a child may interact. Croup is sometimes caused by allergies or bacteria. Rarely, croup can be caused by reflux from the stomach. Children under 3 years of age are most likely to develop croup, but children of all ages can develop it. Diagnosis. Your healthcare provider will ask you about your child's medical history and symptoms. He or she will also perform a physical examination. Your healthcare provider will observe your child's breathing. He or she will listen to your child's chest and examine your child's throat. He or she will ask you if your child has a history with croup or other illnesses. In rare cases, a healthcare provider may choose to perform a chest X-ray. He or she may also monitor the amount of oxygen your child is getting. Your healthcare provider may also choose to do a blood test in rare cases. Treatment. Most cases of croup are mild. It is most often treated at home. Moist air can help lessen the symptoms of croup. Placing a humidifier in your child's room may soothe his or her throat and reduce coughing. Clear water can help loosen mucus buildup in the throat. It can also help prevent dehydration. Over-the-counter cough medicines often help with croup. Pain relievers like children's Tylenol and ibuprofen can help reduce a fever or help a sore throat. Aspirin should never be used to treat the fever and symptoms of croup. It can cause Reye's syndrome, which is a rare but serious illness. Reye's syndrome can cause swelling in the liver and brain. This is why healthcare providers recommend other pain relievers for young patients. Crying can worsen a croup cough. Try to comfort your child. Distract him or her with a light activity like reading a book or watching a movie. In rare cases, a healthcare provider may give your child a steroid to help reduce swelling and inflammation. This can help with your child's breathing. Severe croup may need hospitalization. Croup is contagious. This means it can pass from child to child. You may prevent the spread of croup by washing your hands often, quickly treating cold and flu symptoms, avoiding children who are already sick, avoiding smoke and exhaust fumes.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Croup is a disease that causes problems with breathing. It is most often caused by a virus. Croup is common in young children. It causes a cough that may sound like a dog or seal's bark. Other symptoms of croup include difficulty swallowing, hoarseness or a scratchy throat and voice, mild breathing trouble, stridor or wheezing. Croup is most often caused by a virus such as influenza or the flu. Other viruses that can cause croup include adenovirus, parainfluenza, measles, respiratory syncytial virus or RSV, rhinovirus. Most cases of croup are mild. It is most often treated at home. In rare cases, a healthcare provider may give your child a steroid to help reduce swelling and inflammation. This can help with your child's breathing.
Thank you for using Explain.